Hi there, my name is Lerato. I'm a registered nurse and midwife. I'm currently working in the public healthcare system. Today I'm here to talk to you about newborn screening and visits. What is it? Why is it important? So when your baby is born, immediately after birth, that's when they undergo their first screening. This is where we assess them from head to toe, firstly using the APGA and then also using a systematic assessment. So we normally check things like the heart and lungs for any abnormalities, the abdomen to make sure that all the organs are in place, the cord to make sure that there's no displacement, the hips, and most importantly the reflexes, which give us information about the baby's nervous system. So this is very important. At day 3 and day 10, you might have postpartum visits. So this is also when we screen. Normally on day 3, we screen for things like jaundice. And then sometimes in some private facilities, they would have taken bloods at birth. We normally screen for things like thyroid disease and even check blood type to prevent complications between mom and baby if they have different blood types and incompatibility and things like that. It's important to make sure that you take the baby for all the well visits, because this is when they check their weight, their length and their head circumference to make sure that baby is growing well. We also check that baby is feeding well and developing as they should for the stage that they are at. The special tests that are done also in hospital sometimes are the heel prick, which check for a few congenital abnormalities. And what's very important is the hearing and vision test. This makes sure that baby's hearing and vision is fine and they are developing well. A last important check is of course the 6-week visit. This is when baby will be checked for growth, for development, and they'll be getting the next set of immunizations after the ones that they got at birth. It's very important to make sure that you take the baby for the well visits. You make sure that they get screened for any abnormalities so that we can manage them well and help you manage them well. Hi there, my name is Lerato. I'm a registered nurse and midwife, currently working in the South African public healthcare system. Today I'm here to talk to you about your postpartum checkups. Now, postpartum checkups are very important. Many people forget that after the 3rd trimester and the birth of the baby, there is what we call the 4th trimester, which is your postpartum period. Now, when should you go for your postpartum visits? So according to guidelines, you need to have a visit on day 3 post-delivery or within 72 hours, about 7 to 10 days after delivery, and the most important one, which is the 6-week checkup after delivery. So normally at your day 3 checkup, we'll be assessing your wound, we'll be assessing if your uterus is contracting well, if you're not bleeding. If you have a C-section wound, we'll check if it's healing, how you're managing with pain, supporting you with breastfeeding, and of course giving you the emotional support that you need, because this is a very difficult time with all the hormonal changes that are happening in a woman's body. It's also important for the baby. Most of the time when babies have physiological jaundice, it shows up within 72 hours. So that's why that visit is very important. The nurse or doctor will check the baby, make sure the cord is still well, make sure the baby is feeding well. They may weigh them, but normally within the first 3 days, the baby does lose a bit of weight, but it shouldn't be more than 10% of their body weight. After that, you'll come for your 7 to 10 day checkup. It's pretty much the same, except now we want to, if you are breastfeeding, we want to make sure you have enough supply and that baby is gaining weight. This is a very critical point where if you have any like foul smelling discharge or any distressed emotional state, that's very important in that checkup, because that's normally when we'll pick up if there's been an infection, or if maybe you might be at risk for things like postpartum depression. And then lastly, there's your 6-week checkup. This is the most important one. Normally, this is where family planning is discussed, whatever family planning method you may have chosen, although you can start immediately after birth. What's very important, and I want to emphasize, is to make sure that you do your pap smear. A pap smear is always important after birth. This is to make sure that you're not at risk for cervical cancer, and to just screen you for HPV so that we know how to prevent it further. And then we'll check the wound healing, your uterus, etc., your vital signs. And then the same for baby. This is when baby's development is checked. We'll check his weight. We'll make sure that they get their vaccines as well. So the 6-week visit is very important. In between, there are also like well baby visits, where you'll go to weigh in baby, make sure he's feeding well, make sure he's developing well, etc. And then lastly, I just want to tell you that if you have any danger signs, which I'm going to list now, you don't have to wait for your appointment to contact your care provider. If you have severe bleeding with clots, a severe headache that doesn't resolve, especially if it's accompanied by blurry vision, if you have severe chest pain and coughing, if you have foul smelling discharge that's accompanied by fever, or if you have emotional distress that doesn't resolve within 2 weeks, you need to come to the nearest healthcare facility so that we can prevent further complications.